You just never know with me, right? Good morning, ladies and gentlemen. It's great to see all of you here this morning on this beautiful, clear, awesome, warmer than normal, but still cold morning. I'd love to invite our mayors and any county commissioners that would like to come up and join us. We'd love to have you up here. Don't be shy. Come, city council members, anybody that wants to come up here. This is about you and the great work that you're doing. It's so cool to see so many of our amazing public servants, local public with us. The Lieutenant Governor is here as I want to recognize Sophia DeCaro, who is the direct budget, who is here with us. Her team has worked so hard to put this budget together. Thank you for joining us. We'd like to thank our media partners who are here as well. Yeah, don't be shy. Make sure you can be. Ladies, that I wanted to give it its own time, and again wanted to recognize the great work that is happening here in our state with our local officials. We're missing Mayor Mendenhall and Mayor Wilson out of town today, unfortunately, but I will be talking about them because we've been working so very closely over the past several months. Obligation budget to the legislature. Here, here. Especially want to recognize the state of Utah. Anyone who hasn't been able to join us in all of our events, but Pamela Atkinson is here with us today. Pamela, we love you. Thank you for being here. I'm not going to make we're so for you. And now, one of the most complex problems facing our country, our cities and towns, and that our people face today is homelessness. We've seen, sadly, lawlessness, open drug use, untreated mental illness, and the indignity that comes from tent cities in places across our great country. And we are not going to allow that to happen here. We can and we must do better. Several months ago, I challenged our team to really dig in to the entire framework that we've set up to address homelessness. So the Office of Homeless Services, the Departments of Workforce Services, Public Safety, Corrections, Health and Human Services, the Governor's Office of Planning and Budget, and my senior team all took up that challenge. We've got to happen here in the state of Utah. We can do both of those things, and we must do both of those things. Accordingly, First, we need to address the immediate crisis of chronic homelessness. There simply aren't enough beds in the current emergency shelter system, with most shelters in Salt Lake County being nearly full every night. To that end, we are recommending $128 million to support maintenance and expansion of our emergency shelter system. This funding will help stabilize the current emergency shelter system and provide support for 2 non-congregate shelters, 2 low-barrier shelters, our statewide winter response, a low-barrier shelter development, and additional support for cities that host emergency shelter sites. I want to thank those cities which have already stepped up to provide overflow shelters and warming centers so far this year. You are a key part of the solution, and I hope more communities will follow your example. Second, we know that unaddressed behavioral and mental health issues can cost up to 10 times more in healthcare and criminal justice spending. This is especially acute among Utahns experiencing chronic homelessness. The fact is that the system for getting help is complicated, and those in crisis need navigators to guide them on the road to recovery and housing. Utah needs 8,000 additional behavioral health care workers to meet that demand. As a result, we're recommending $8 million to alleviate the workforce shortages in our behavioral health system. This includes $3.3 million one-time for paid internships, loan forgiveness, and incentives for training. $2.9 million ongoing for another rural receiving center and 2 additional mobile crisis teams, and $555,000 one-time for a pilot project in the Office of Professional Review to increase behavioral health licensing opportunities, and $1.1 million to staff this facility, the Atherton Community Treatment Center here in West Valley City. The Department of Corrections currently operates 6 re-entry centers like Atherton, which help parolees successfully adjust from the highly structured prison environment back into the community. The goal is to break the cycle of recidivism. People should not be leaving jail or prison and going right into our homelessness centers. We look forward to returning to Atherton when it is fully staffed and open for business. Third, we need a mechanism to keep people in extended treatment if they present a danger to themselves or others. 90 years ago, we would just throw people who needed mental health care into the state mental hospital. There were a lot of problems with asylums, but as the data shows, we effectively traded mental hospitals for prisons and living on the street. Now, I want to underscore this. During the 1950s and 1960s, we had about 3,000 state hospital beds or asylum beds in the state. Now, let me be very clear. There were lots of problems with asylums and the way that we treated people those days. Unacceptably so. We've learned so many lessons over the years, and we understand that there is a better way to treat people. But we did have 3,000 state hospital beds back in the 60s and 70s when there were only about 750,000 Utahns. Today, we have about 300 state hospital beds, and we have 3.3 million Utahns. Where are those people today? Those people are living on the streets or they are in our prisons. I don't believe that this is a step in the right direction for our state, for our country, and for our communities, and certainly not for the people who are suffering. We should expect more of ourselves, more of ourselves as a society. There is nothing humane about letting someone with an open wound on his leg sleep out in the freezing cold and shout at the voices in his head. We can do better, and we'll be working with the legislature on strengthening our civil commitment laws. We also need a way to divert individuals in crisis from unnecessarily entering the criminal justice system. We often send individuals in crisis to jail because we don't have other places where they can get the treatment they need. And once they're in the criminal justice system, that often exacerbates the very behavioral health crisis and traps that people in a cycle of jail and homelessness experience. We are proposing a $10 million one-time investment and $641,000 ongoing to launch a less restrictive civil option for individuals with mental illness who do not meet the standard for civil commitment or criminal diversion courts. This home court, as we're calling it, will create an effective alternative to the criminal justice system while still holding people accountable. Finally, we are committed to supporting a sequential intercept model to better connect individuals with mental health and substance use disorders to treatment and wraparound services. Recommendations include funding for a behavioral health treatment facility in West Jordan, as well as $190,000 ongoing and $6 million one-time for local governments to better manage paroled individuals. Finally, at its core, situational and transitory homelessness is largely due to the lack of access to affordable housing. Currently, there are only 3 available units for every 100 extremely low household. Now, while we have had significant funding over the past couple years, and much of that is still being built right now, we are recommending an additional $30 million for deeply affordable housing that will help all Utahns access stable and safe housing, no matter their income or state of physical or mental health. We're also recommending an additional $10 million for the Utah Housing Preservation Fund. This public-private partnership purchases affordable housing and ensures it remains affordable for an average of 20 more years. We're grateful for our private sector and philanthropic partners who support this important effort. Now, again, these are very robust recommendations. We look forward to working with the legislature and helping to get those passed. I do want to turn some time over now to Wayne Niederhauser, who has been so influential in helping us to bring these recommendations together, helping to unify our cities and counties and service providers together with the state in helping to reach out and solve the crisis of homelessness. Wayne.
Thank you, Governor. Appreciate it very much. Governor knows this space very well. He, as Lieutenant Governor, led the effort on homelessness, and we appreciate his leadership in homelessness. And Pamela, I also want to thank you for your many years of dedication and a mentor to me as I've taken on this role in the state and trying to address homelessness. Thank you. And I also want to thank the efforts of the Governor's Office of Planning and Budget and all the effort they put into this budget this year. It's well done. Thank you. I can't, sadly, homelessness is the catch-all for people in crisis. And the pandemic and the housing costs that we've experienced over the last several years, unprecedented, is prolonging stays in shelter and preventing people from getting back into housing. This is why it's so important that we address these gaps that the governor mentioned today. It's a difficult fix. And these cracks can become chasms, and we need to stop it before it gets to that point. As the governor mentioned, we need additional emergency shelter beds in the system as chronic homelessness is on the rise. Behavioral health services will help these individuals stabilize. Once stabilized, we need somewhere to go. Creating deeply affordable housing is crucial. These three elements will be a game changer for the entire system, and more importantly, our homeless friends and neighbors. And may I also add that we need to go upstream. Prevention, as the governor mentioned also. 8,700 people experienced homelessness for the first time in the state of Utah in 2022, and that is unacceptable. The governor's dedication to this cause and inspiration, and I'm confident that through collective efforts, we can make meaningful strides in addressing homelessness throughout the state. Homeless is a community condition, and it's going to take community to remedy it. Thank you.
Thank you, Wayne. We know that these budget recommendations are a heavy lift, but we also know that they will save lives. They will get our homeless friends the help that they need and deserve. They will create good paying and rewarding jobs that lift others. They will fill a critical need in our housing stock. And lastly, this will help prevent homelessness in the future. Again, I want to thank the local officials and civic leaders who are so engaged in this every single day in their communities for coming together in an unprecedented way to address this crisis. With that, I'm happy to take any questions that you might have. Sure. Yeah. So Basically, deeply affordable housing is housing for families making under $31,000. We have these units available. Oftentimes, when a new apartment complex is built, there will a segment of those will be set aside for deeply affordable housing. We've had significant funding increases over the past couple years, building entire units that are all affordable housing deeply affordable housing. Many of those in Salt Lake City. We appreciate Mayor Mendenhall and her team and their efforts. There's some federal funding pieces that come from this, some state funding pieces that come, some local funding pieces as well to help those in need. Wayne, anything you would like to add on that piece on the deeply affordable side?
No.
We good? Okay. Go ahead.
The governor mentioned earlier that we have 100, or there are 3 units for every 100 households that are in this deeply affordable 30% area median income and below. That's 77,000 unit deficit in the state of Utah.
Other questions? Yeah, that's a very good question. Obviously we'll be working through the legislative session. We need them as quickly as possible, and so we want to get that funding out there to help encourage more people to go into this space. There's another piece here that I haven't mentioned. It's more of a policy piece, but it's really important. We have done a deep dive over the past year. The Department of Commerce looking at the licensure side of behavioral health care, and what we found is that we are doing it wrong. We're doing it all wrong. And let me say what I mean by that. We have, last I heard, we have about 5,000 students that are studying psychiatry, getting bachelor's degrees in psychiatry. Unfortunately, there's almost nothing you can do with a bachelor's degree in psychology. I said psychiatry, sorry, psychology. Almost nothing you can do with a bachelor's degree in psychology. This is a major flaw in licensure in our state. If you look at the medical profession, there is basically, coming out of high school, you can get certified to do something in the medical profession. If you have a 2-year degree, there's something else you can do in nursing, right? If you have a 4-year degree, if you have 8 years, if you get a medical license, at every phase there is something that you can do in that field. That is not true in psychology and psychiatry. We think that's a mistake. We think that we can make significant changes. There are great recommendations to make those changes. We think there's a workforce out there. We're just not allowing them to do the work. Now, they won't be able to do everything, obviously. There are certain things that you must have more expertise to be able to do, but there is so much more we can do in this space. And so I think when you combine this funding with the changes that we will be working on through the legislative session. And let me assure you that this is going to be a top priority for us, getting those licensure changes done. I'm going to send just a little word of warning out there to the associations who are going to try to prevent this for protectionist reasons. It's going to be a very bad day for you. So you can be part of the solution or you can be part of the problem. This is not about protectionism. This is about tens of thousands of Utahns who can't get treatment right now because it takes 5 months to get into a psychologist or a psychiatrist, right? That is unacceptable. And so if you want to fight on this, we'll have a fight. I'm just going to lay that out there, but we are going to get this done this year. We're going to be providing many, many more opportunities for people to get the help that they need. Look, here's what happens. If you treat mental illness early, and sometimes it's very simple. Someone just needs a friend or a mentor or someone to talk to, right? You don't need to be an expert to be able to do that. If you can treat it early, then it doesn't progress and people can move on and get on with their lives. If it remains untreated, it can get worse until you must be hospitalized, or you can only work with a psychiatrist in a brick and mortar building. There are better ways to do this, and we're going to change licensure to make that happen so that we can have an influx very quickly of thousands of people into this space to make a difference. Any other questions? All right, seeing none. Again, thank you for being here. Stay tuned tomorrow. We have another very, very big and exciting announcement and lots more budget numbers. We hope to see you all there. Thank you.